Okay, welcome everybody to this second session as part of our SciBeh workshop. Um, this session is addressing the interface between science and policy, in particular in a situation of crisis as we're currently facing. So the way this is going to work today, and I may be repeating things if you weren't here this morning, I just want to give you a minimum set of instructions about how to participate. And first of all, we have a Q&A facility, which is available to everybody listening at the bottom of your Zoom window. If you click on Q&A, you will get a window that allows you to ask questions, and I will be monitoring that whenever we have open discussion to respond to that. In addition, you can also participate in the chat in the usual manner. And we will try and respond to questions there as well, although we prefer to channel it through the Q&A. Okay, and I think that's all the instructions we need, so let's get going. The format of this meeting today is that we have two speakers followed by a panel discussion, and each speaker will also be followed by a brief Q&A involving everybody in the audience. Now, I'll be introducing our speakers as they present, and I will then also introduce our panel members as we turn to the panel discussion. So, without further ado, I will then introduce our first speaker, who is Alison Wright. She's a senior research associate at UCL, and she's leading a team of behavioral science researchers there working on the Human Behavior Change Project. And in this session, she will talk about that project. And the title of her talk is The Human Behavior Change Project, Providing Evidence for Policy Making. So now, over to you, Alison. Feel free to turn on your video, and you should be able to share your screen if necessary. Aha, very good. You're still muted.
Let's try that again. Hi, everyone. Good morning. Fantastic. Thank you very much for the invitation to be here. Okay, great. So,
and if you want to share your screen, go for it. Aha, very good. Perfect. That seems to have worked.
Okay, brilliant, great. So yeah, thank you very much for inviting me to speak at this workshop. I'm going to talk about the Human Behavior Change Project, and particularly about its potential role in providing evidence for policy making. I should say that this is not a single person effort. There is a large collaborative team behind this across University College London, IBM Research, Aberdeen University and Cambridge University, and we have 3 disciplines working together. I'm part of the behavioural science team. We also have computer scientists and systems architects. Okay, so our starting point was interventions to change behaviour, which obviously are essential to improving well-being. And during the COVID-19 crisis, obviously, while we don't have very effective drugs and we don't have a vaccine yet, actually one of the key things is getting populations to change their behaviour in ways that are likely to reduce their risk of contracting COVID-19. And in fact, even when we do have a vaccine, vaccine uptake is a behaviour that we will need to promote appropriately. There's been a lot of money invested in interventions aimed at individuals, communities and populations over the years, but most of these interventions, when evaluated, turn out to have pretty modest effects, and their effects are highly variable. And this makes it tricky to apply behavioural science to solve real-world problems that policymakers might have. As has been touched on in the discussion document for this workshop, systematic reviews are a key tool for bringing together evidence in a way that is helpful for policymakers, a way that makes evidence more digestible. But the issue we have at the moment is evidence is accumulating at a rate much faster than the traditional manual evidence synthesis methods can handle. You know, it's estimated there's hundreds of behaviour change trials published every single day. And so you end up with reviews that are out to date by the time they actually manage to be published. The other issue for policymakers is that the question that was interesting to the researchers who did the review may not be the question that's of most interest to policymakers. It may not be framed in the same way. The inclusion or exclusion criteria might not fit the context in which the policymaker is trying to make policy. We also know that many tasks involved in evidence synthesis have the potential to be automated. So the Human Behaviour Change Project is an example of a project bringing together behavioural science, computer science and information science. And we're trying to create something we call a knowledge system about behaviour change interventions. And this consists of 5 key elements: an ontology of behaviour change interventions and their evaluation reports, and I'll talk a little bit more about what that is in a moment. A largely automated feature extraction system, which we describe as almost reading the reports. A database of behaviour change interventions, which contains the information extracted from the evaluation reports using this automated feature extraction system, and it's structured according to the ontology. And then a set of reasoning, recommendation, and other types of machine learning algorithms, which can synthesize this information in response to user queries. And the final key part is an interface for both computers via APIs and human users to interact with the system. So this is a system where the vision is that people will actually be able to input their specific queries and get answers to their particular questions. So a key element of the Human Behaviour Change Project has been creating an ontology of behaviour change interventions. For those of you who are familiar with ontologies, they're basically a system for representing knowledge in terms of a unique set of classes or categories, the labels or definitions for these, and the specifications of the relationships between the categories. And they're very useful in fields where different domains are all interested, in that they provide a language for interoperability between different domains of knowledge, and can also be used to inform automated reasoning systems. So it should be noted, for example, that there are efforts to already put together coronavirus ontologies, which may be useful for use in annotation of the coronavirus literature. This is the behaviour change intervention ontology, which I am not going to attempt to explain all the detail in a 10-minute talk. What I will say is the blue side is about the features of behaviour change interventions. So we see interventions as having both content that is delivered in particular ways, and they take place in the middle of scenarios which involve the populations, the settings, and the key target behaviours. If you want to read more about the ontology, the paper at the bottom of this screen will give you the full rundown of it. In terms of how we use machine learning and artificial intelligence, the HBCP, which I know it's a particular interest in this workshop to think about how these kinds of approaches could be applied to the coronavirus literature in various forms. We have automated study identification developed by our systems architecture colleagues. So this uses Microsoft Academic, and they've evaluated Microsoft Academic and found it's, if you use this one particular source, you don't need to be going to things like PubMed and Web of Knowledge. That actually, this has really good coverage across all the databases that you might have traditionally searched for in systematic reviews. Data from here is pulled into a central store regularly, currently around weekly. Machine learning algorithms then identify research that is relevant to the Human Behaviour Change Project and send it to our evidence system. At the moment, we're focusing on the use case of smoking cessation because it's an important public health problem, but we do see this eventually being broadened out. And this approach that we've developed for this is also being used by our collaborator, James Thomas, to create a living systematic review of the COVID-19 evidence, which the link for is here. We then have automated information extraction, which uses a FLAIR model using named entity recognition. And this has been trained using manually annotated data. So my team has annotated over 500 randomized control trial reports for an awful lot of entities. It should not be understated how much annotation has been needed to train this system. That would be one of my probably key messages. And the particular problem is that behaviour change is one of those topics where actually people use words in conversation that don't have quite the same meaning when they're used more technically in science. And I think that's probably something to think about for coronavirus, particularly if you're thinking about grey literature and other kind of forms of things. Actually, how are people using words? And do they always mean the same thing by the same word? If you're interested in trying out our information extraction, we have a little demo up at this link. We then are using predicting study outcomes, and this has been developed via a novel approach which they're calling prediction algorithms from vector space, and that's been trained on the same 500 reports. And what this does is basically represent each possible scenario, so each type of behaviour change intervention, in a computable format, and then uses similarity estimation to estimate hypothetical outcomes. So, how likely is it that this intervention done on women aged 50 and older and providing nicotine replacement therapy, what's the likely quit rate associated with that? We're planning a series of user interfaces, so these are sort of successive iterations. The first of which is just going to be letting people browse the research according to the ontology. So we'll have annotated records that have the information automatically extracted, pulled into the database. So this would let people do things like find me studies that look at the impact of action planning in adults aged over 60. So this might be one point where actually people who are willing to actually look at evidence, policymakers who want to find something, can actually use this to be quite specific about, I need to find information about this population in this country with these features, kind of thing. We then have a first version of the prediction, which we're calling Help Me Change My Behaviour. It's almost framed around people who want to change their own behaviour. And here the interface is going to guide people to compose queries in a way that specifies the query in sufficient detail. So just asking what works to stop smoking doesn't really help. The question is for who, in what circumstances, and what level of smoking were they doing in the first place. And then our final UI will be a full research and prediction interface. So users will be guided to compose more specific queries, and this could include things like the sort of questions you get in systematic reviews of behaviour change interventions. And they'll receive answers together with information about the research studies those predictions are based upon. So I think ultimately this might be the point where it'd be very useful for the system to interface with policymakers, that actually you would let people put in their queries and get quick answers to things like, what works for people with no more than a GCSE level education, who smoke very heavily. And as I'll say, the eventual plan is that this system will broaden out to more behaviours than just smoking cessation. In terms of challenges of using an AI-based knowledge system as an aid to policy making, one of the things we're working on at the moment is to think about how do we present the results in a format that's going to meet the needs of policymakers. What do they want to know? What do they want to see? How do you present uncertainty around the estimates to them? Issues around the accuracy of the system. So how willing, we know this system will be faster than traditional systematic reviews, but it's probably going to be slightly less accurate. And then the question is, how willing are policymakers to trade off between speed and accuracy? In terms of accuracy, the other issue is that when you're predicting outcomes in public health contexts, very small differences when they're applied to a population can still actually be a meaningful level of change. So actually being out by 3 or 4% in terms of your outcome might actually mean that you miss something that could have been effective. Any AI system is only as good as the data used to train it, and some groups are better represented in the primary research than others, so there's potential for bias. And then the final issue is around explainability. So being able, do people understand what the algorithm's doing? People tell us they want to look under the hood to actually understand what the algorithms are doing, and do I agree with those conclusions? But one of the issues is that sometimes the most explainable algorithms are not the ones that produce the most accurate prediction results, so then you have a tension. And what's the appropriate level of trust in this sort of system? So actually, we don't want people using this blindly and treating it as a sort of perfect system that will give them definitive results, because we don't think it's there yet. But then we don't want people to be too mistrustful of it either. So these are kind of our challenges in terms of bringing artificial intelligence to policy making. Thank you.
Okay, terrific. Thank you very much, Alison. And so we now have time for a brief Q&A in response to that. Anybody who wants to type a question into Q&A is welcome to do that. I would also like to invite our panelists, if they have any questions or comments to make at this point, to let me know, and I can put on their video. If not, then I actually have a question, if you don't mind, Alison. I was fascinated by your the overview between the red and the blue parts in your overall behavioral change thing. Could you flesh out just a concrete example, if there is one, of how this kind of works? I mean, like, I guess I find it fascinating that you have the system and the machine learning component and all that. But if there was some concrete output for behavior change measure, I'd really love to see that or hear about it.
Sorry, I'm not sure I thoroughly understood the question there. So.
Okay, so what? Yeah, I guess what's at the outcome end in terms of for policymakers, or for me as a member of the public?
So the vision would be that as a policymaker, you would come and you say, I want to change these behaviour, or I want to know how to change the behaviour of my citizens, and you would query the system in line with those, and the system would guide you to specify the query in enough detail via the user interface, so you actually got a meaningful answer out rather than one that just went, it depends. The algorithms will then look at the database, which has all those extracted reports in it, just like a conventional systematic review might have an Excel spreadsheet with all the studies kind of arrayed in it, and it will come back, make predictions and make recommendations. So actually your best bet for this population is to do an intervention that has at least 3 sessions, that is delivered by a human being or else by a tailored app, and that contains the intervention components of providing information about the social and emotional consequences of behaviour and action planning for how people are actually going to do the behaviour.
Okay, great, thank you. Now, René van Bavel, who's one of our panelists, wanted to ask a question. So René, why don't you go ahead and unmute and turn your video on. Aha, there you are. And okay, just briefly introduce yourself, because you're one of our panelists and I haven't had a chance yet to introduce you.
Yes, happily. My name is René van Bavel. I work at the European Commission at the Joint Research Center, so a little bit at the interface of science and policy. And in my previous life, I was an academic, so I'm enjoying this very much, having one foot in each of the whatever domains. So, I love this. It seems so interesting and so necessary. So, just from my point of view, if the policymaker needs some evidence, they will ask somebody like me, who works in the in-house Commission Science Center, to come up with a literature review on this. So it's kind of oftentimes the knowledge brokerage role. So I guess I would do the regular. I would look through the literature, read papers. The minute I find a good paper, I see what that paper reference to. I follow the trail, and I get, over the course of a week, maybe an idea of what's happening. So my question is, just so that I can explain this to my colleagues, what would this system offer me beyond, say, Google Scholar, just to make it a bit of a caricature, Well,
okay, so this system would firstly have identified all the relevant studies to your query without you having to go out and do that following the breadcrumbs issue. So like, I read one useful study and I'm going to follow up the things in the references. So that would be one thing. Then it would save you time on extracting the information from those studies if you're actually trying to, so you wouldn't have to do that manually. Or actually, probably the first thing we'd probably recommend to people when we start sort of disseminating this a bit more is perhaps people use the algorithms to replace one of the 2 people you might have doing data extraction in a conventional systematic review. Might be a sort of in between step. And then it's not going to quite do the same as a traditional regression-based meta-analysis, but it will make predictions about which, based on the data in each of those studies. So if you can imagine, it's got in its database each study represented in terms of the features of the study and the outcome variables and the impact of those study features on the outcome variable. So it will be able to ask your question and come back with a prediction that says the biggest change, the biggest effect is achieved under these conditions. If that makes sense.
Yeah, yeah. Interesting.
Okay.
Thank you very much.
Thanks for that, both of you. Now, in the meantime, 2 questions have come in. The first one, Alison, from Ulrike is, how far is this system from development? I mean, like what time frame are we talking about here to roll out?
Okay, that's an excellent question. So we have finished annotating reports for smoking. We are looking to roll out the first of the interfaces in the first quarter of 2021. So the simplest one, which lets you browse studies and find bits of the ontology. But then looking throughout 2021, as we should have the second sort of help me quit one. So the first one that's actually using the prediction algorithms towards the second half of the year. And then the final one should hopefully be out by I think we've got November in the project plan at the moment. So yes, very much hoping to have everything out by the end of 2021. So it's a good point to be in the project actually, because to see it all coming together.
Okay, great. And then the second question, in fact, one that just came in, is about transparency. The fact that you have an AI approach, which could be seen to reduce transparency. And I don't know if you attended the previous session this morning, but we just had a session on transparency. And so I think that's an excellent question. Can you tell us a bit more about that?
Yeah, this is really interesting issue. And I very much agree that one of the cautions that people often have looking at AI approaches is that difficulty in verifying what's it doing. Is it doing it to the same standard as me as a human would do it? I think one of the interesting things is that as evidence comes out as to how well a system performs, actually people seem to get slightly less concerned about transparency. So I think probably the screening studies for inclusion part is probably the bit where in the automated systematic reviewing literature there's been most work. And actually some of these methods perform better, or at least as well as humans, and use an awful lot less effort. So at that point, people seem to start caring a little bit less about transparency. I think it's something that people are willing to trade off a little bit, that actually, if they know the accuracy is the same or better, then they get slightly less concerned about the transparency. But I absolutely agree, it's tricky. And we do have this thing that actually there is this trade-off between you can have accurate prediction algorithms, which are hard to explain exactly what they're doing, versus you can have slightly less accurate ones, but you can tell people, oh, this is like a regression-based approach and it puts these parameters in and it predicts an outcome. So that's
And also, presumably, that's yet another question. It connects very nicely. Couldn't the algorithm also point you to where the evidence came from, so you can kind of follow up on that and do an audit? You get the answer fast, and then you do the audit just to make sure it's all right.
It's exactly, yeah, that's the vision. So the third of the user interfaces will both make predictions and show which studies those predictions were based on, which ones they were drawing on particularly heavily, give you the references to them, also give you the information that's been extracted from them that it's using. So you'd actually be able to say, well, this is Wright et al. Study and the system thought it had these things in it. I can go and find a PDF of Wright et al. And check whether it really does have these things in it. And that might kind of increase my faith in what I was getting.
Okay, terrific. So thanks so much for that, Alison. What I'm going to do now, I think, is I'll hand it over to our next speaker, who is Lindsey Pike. She is an impact and policy engagement manager for the University of Bristol. So she's a colleague of mine. She was a researcher on the Evidence Information Service project. And the title of her talk is Connecting Research and Policy Problems and Solutions. So over to you, Lindsey. You should be able to unmute and also to share your screen if you wish.
Thank you very much. Okay, I'll just share my screen now.
Okay.
So hopefully that's working. Okay, so hi everyone. It's nice to be here. Thank you very much for the invitation. So yeah, my name's Lindsey Pike, and I'll start off by asking you to bear with me because I use a breathing technique to manage a stammer. So I've spent about 12 years, I guess, working at in the grey area in between research and policy or practice, and I'm planning to briefly outline findings from a research project called the Evidence Information Service, which I played quite a small role in, and then sort of drawing on the workshop discussion paper, provide a sort of broader overview of the sort of ways in which research and policy are being sort of encouraged to engage right now in the UK. So the research project was led by my colleagues on screen now, and I've ruthlessly plagiarized their slides, so many thanks them. And this was broadly looking at the question of how you can make sure that parliamentarians in the UK especially are using research and engaging with the research community. So it's fairly, it's been known over quite a long while that there's a fairly small proportion of the wider academic community that engage with policymakers. This report was from 2013, was published by the Government Office for Science in the UK around that. And so we were interested in whether we can help provide Parliament especially with broad and rapid links with researchers. And by Parliament in the UK, we meant both the UK Parliament and the devolved administrations in Scotland, Wales and Northern Ireland, including their research services. And so there's quite a bit of research that's been done around barriers that stands in the way between researchers and policymakers engaging, and like Chiara mentioned earlier on, one of those is the sort of the timescales within which they work. The policymakers need the evidence last week. We can probably provide it next year. It's a bit tricky. There's a lack of time from the policymakers' side, so they won't have time to read your whole paper. They need a really brief summary of recommendations, and finding the right, most robust and ideally synthesized research is also quite a challenge. So we proposed to create a database of UK researchers with expertise in a wide range of things, which the research services and parliamentarians would be able to pose a question. We need the evidence around this thing, and then the database would sort of matchmake, I suppose, and find the expert with that expertise and link them up. And that's the main point, I suppose. It's more around accessing the expertise rather than accessing specific research. And we thought this would be beneficial in numerous ways. It would increase the diversity of scientists that are engaging with policy, and also sort of spread it out a bit, because in the UK there's a problem, I guess, of most policy engagement comes from academics based within what we call the golden triangle of universities sort of near Westminster, and so it would sort of make that a bit more democratic and broaden it out a little. And back at that time, there was really widespread enthusiasm from both sides, so from the research side and policy making side. But we recognise actually that just providing a database isn't enough, because we also need to make sure that both sides sort of speak the same language, so that they really get the pressures, the drivers, the needs, the motivations of the other side, that they know how things are being spoken about on the other side as well. And recognising, like Chiara mentioned again, that it needs that encouragement and incentivization as well, because it's not easy, it's not always straightforward trying to sort of cross that boundary, I suppose. So we created a report which really questioned like this main question around trying to create a database-led model with some form of automation versus a knowledge brokerage-led model, which sort of mostly relies on human expertise. And we weighed up how both of those models might work, the practicalities and the costs. And we drew on the evidence that we'd collected, which really found that policymakers value relationships and that sort of shared understanding and trust. So knowing that the academic they're working with gets what they need, that clear presentation really promotes research use as well. So again, like Chiara mentioned, the speed that decisions are being made means that real clarity and sort of focused recommendations are really quite key, and that different policymakers need findings presented in different ways as well. So plus there were all of the issues around trying to create and maintain a database, and various problems linked with that. So we actually concluded back in 2019 that, so last year, that a platform like that wouldn't really be feasible, because the cost benefit wouldn't work out. At the same time, the broader landscape of policy engagement within the UK was changing really fast, and so we really questioned what might a database like add that would be better than what's out there already. And so for this next part, I'd like just to quickly outline like some of those initiatives that are trying to sort of smooth over the process of engaging with policy. So there's quite a long-standing body of research around this, which stretches back over many years. It's worth looking up things from the Alliance for Useful Evidence is a good starting point. And there's research that's been done by colleagues like Paul Kearney and Catherine Oliver, who actually have tried to state what works in policy engagement. So there's plenty of very well-meaning advice from people like me who work with academics, but no really strong evidence base around which things work best. And their conclusions are that really it's mainly about co-production, working closely with policymakers and creating those mutually reciprocal trusting relationships, so that your research questions are sort of focusing on what they're interested in, and they can sort of be more of a part of that research process. So the UPenn network stands for Universities Policy Engagement Network. It's got nearly 70 members, mainly made up of professional services staff like me in UK universities. They are a conduit right now for requests for evidence from policymakers. They also run training on both sides and create working events and numerous more things. Also in Parliament, there's a knowledge exchange unit that's based in Parliamentary Office of Science and Technology, and they also have a sort of brokerage role of trying to sort of bring in a more diverse range of research expertise into parliamentary sort of decision making. Like in our civil service, recent reports and things have recommended that they publish what their areas of research interest are, which they mainly do now, which is really useful for just finding out what their key questions are. And much more recently, actually last month, the Knowledge Exchange Unit at Post created some like COVID related questions, which researchers can review and then sign up on a database that sort of notes their expertise. And then there are sort of new research projects like the CAPE project, which is looking more about that process of policy engagement, and things like the open like innovation team in the Cabinet Office, which again tries to link up research with policymakers. So that's a really brief run through what the broader landscape, I suppose, in the UK. I guess my main question is, how can AI sort of complement or replace the role of human expertise and knowledge brokerage, especially in the light of the research that aspect of it is really quite critical. And that's me. Many thanks.
Okay, thanks so much, Lindsey. That's fantastic. So as before, we now have a Q&A, and the first person who wants to ask a question is one of our panelists, Mirjam Jenny, who should be able to turn on her camera and microphone now. Mirjam, go for it. And please start out again by briefly introducing yourself, since you're one of our panelists. Your co-host, Mirjam, you should be able to go. She is, I can see her as a participant. Okay, well, maybe while she is figuring this out, maybe with Ulrika's help, it looks from here as though she should just be able to go, but it's apparently not happening. Anyway, we have another question coming in. Very good. Mirjam, you found the button. Wonderful. Welcome.
I found the screen. I have heavy feedback. Can you maybe mute yourself for a moment?
I muted myself just then.
Okay. Thank you very much, Lindsey. That was very interesting, and I actually wish that we had a similar organization and projects as you do in Germany. I have two questions that I would like to ask based on two big challenges that we actually have in Germany. And one is that, especially in the beginning of the COVID pandemic, a lot of the recommendations and a lot of the scientists that were prioritized by politicians were male. And so I was wondering what kind of methods you have to make sure that the scientists that get talked to and basically get a voice are more diverse than that. And also, of course, we would then would have to build in the same processes into AI. Yeah, and so I'll just leave it at that as my first question.
Yeah, thanks. That's really relevant actually, because oh yeah, I've got massive echo as well now. Thank you. Oh yeah, I think that's better. So yeah, diversity is actually a really sort of main priority in numerous places. So the UPenn network that I mentioned, they have a working group that I'm actually part of, which really wants to work on that, because the evidence shows that actually the academics that engage with Parliament more often are more senior, probably white men, and actually it comes from both sides as well. So the knowledge exchange unit at Post is also really keen to make sure they have more diverse researchers engaging with them. So they've been running workshops specifically for researchers of colour, and for women researchers, and for researchers with disabilities, to one, provide them training about how you go about engaging with policy, but also really to encourage them. And I think there is a recognition that actually, like, the evidence that we use is skewed, and we need that really wide range of diverse voices, and especially in policy making, where I'm fairly sure we've had that same problem, I guess, where there's a massive like gender imbalance, and that means that women's challenges around the pandemic have been neglected much more. And so I think it's a problem that's being recognised. I think it's partly a problem on policymaker side, I guess, that needs sort of, flagging up and highlighting repeatedly. But from the researcher aspect of things, we should definitely be encouraging diverse voices and diverse messages, because we all know that makes decision making stronger as well.
Okay, thanks for that, Lindsey. Mirjam, could you mute again? I think whenever you're unmuted, the echo starts. Oh, thank you. Did you have another question? Did you want to?
Yeah, just very briefly, one thing, if we have time. Yeah. Okay. And actually, the problem is even accelerated by, at least in Germany, by the fact that a lot of the research we conduct is based on political funding, so funding that comes from several ministries. It's really a huge proportion of the professors and scientists' research budget, and of course, in that way, politics has a big impact on what research can be done, and often, of course, the politicians behind those organizations or in those organizations are also white and healthy and male. And you mentioned that one positive side of your work is that scientists know better what politicians are interested in and the research that's needed. But do you also have in mind how maybe the impact of politics onto research can also be too big?
Thank you. So yes, I think that sort of question of how researchers can preserve their integrity and make sure that the questions that they're asking are useful, but not censored, and not prevented from asking those more challenging or those more politically like difficult questions is really key. I think there's scope for working in a co-produced way with policymakers, while recognizing that they won't always like what they hear. And that's partly for research funders, I suppose, to work on. I mean, in the UK, there's quite a bit of work being done by our main like UK research funding institution on sort of broadening diversity. So things like making sure that a diverse range of people sit on funding panels and things. Just sorry, also linking with your previous question, but I think researchers that do policy engagement need to bear in mind it is kind of a political choice, like, and it's not risk-free. So one of the things that researchers are worried about, I think, is that their findings will be misrepresented or skewed or used in ways that they might not have been intending, or cherry-picked. And so, yeah, it's for knowledge brokers, I think, and the broader community to flag up those questions and sort of make sure that researchers think through where their red lines are, I suppose, and like where they would want to draw a line in terms of their integrity, like in any sort of like compromises that might be needed. So yeah, so there's no sort of straightforward answer, I think.
Okay, well, thanks for that, Lindsey. Now, in the meantime, some great questions have been coming in. So, and just so everybody knows what I'm going to do, I will ask you a few more from the audience. But as this is happening, I will then also shortly ask all the panelists to turn on their video so we can then segue into the panel discussion to continue talking about the issues that have been raised and also the questions coming in from the panel. So the first question that I want to ask you now, Lindsey, is somebody, Abigail, asked that the issue of trust and building trust is very important but challenging. Do you have any specific examples of how that's been done at Bristol and the main learning points, you know, in terms of initial connections with civil servants? Any response to that?
Brilliant. So, I mean, trust is really about creating relationships with people. So in one of my roles at Policy Bristol, we advise researchers to work on the 5 T's, which is basically like targeting. So making sure you know who might be interested in your research findings and who might have the influence to change things within your field, and then timing. So thinking about when your findings will be most relevant and most interesting for them, and then translation, making sure that you're drawing out your sort of main findings and main recommendations and not expecting that they'd read the whole paper, and then drawing on the right tools for creating that message, I suppose. And then lastly, you know, talking. So it's really about finding out who is the main person that would be interested in your research and just dropping them a line. It's really that straightforward. And there are, you know, various mechanisms in the UK. So like the areas of research like interest is are documents that normally have an email address for the department, which will signpost you to the right person, but also working with your professional services, you know, colleagues as well. So there may be staff working in your university who work on impact, or maybe even specialize in policy engagement, and they may have those contacts or the expertise or knowledge of how you would find out, I suppose, and make those things. So do draw on them as well.
Okay, thank you. So what I want to do now is there's one, to me, absolutely fascinating question coming up, but I want to now encourage all our panelists to join us by turning on, you should all be able to do that. You're all co-hosts. So if you could just turn on your video, very good, but not your mics. Thank you. This is working well. I think, who's missing? René? I think, and then I have so many windows open here. I need to, yeah, I think René, well, we can, there he is. Thank you. Okay, I think that's it. I think we're complete now, and there'll be a chance for you to introduce yourselves in a moment. So now here's the question that has come up, and that I find very interesting. What safeguards could be put in place to make sure that all of this doesn't arrive at policy-based evidence rather than evidence-based policy? I mean, to what extent can we avoid academics being recruited to support whatever the government wants to do for reasons having nothing to do with the evidence? I think that's a fascinating question. And that's also echoed by another question by Ulrike about the risks that are posed by co-production of research between policymakers and scientists. You know, especially in the UK, we've all gone through a recent, very interesting episode of a certain political advisor being present at scientific meetings. I think those in the know who I'm talking about. So I want to hand this over to the panel, that question, which to me is essential. And just for now, unmute yourself and start talking if you want to comment on it. And please introduce yourself briefly at the outset if you haven't been introduced. Who wants to take the bait? Lindsey, go for it.
Sorry. So I think one point that's worth raising and might want to sort of like come in on this as well is what researchers need is that really good working knowledge of who does what within the policy making process. So for example, in the UK, the civil service are not political. So they will do the work of the government and sort of draw in the evidence and create policies, but they won't take a view, I suppose, and trying to sort of be clear about who's doing what here. So what will be used purely to try and sort of get the best result rather than maybe be used for political ends, and clarifying who all those various stakeholders are in your context. And then once more, you know, thinking through as an individual researcher what you're comfortable with and not, and then starting from there, I think.
Okay, any further comments on that? Yeah, Rachel, please, and introduce yourself if you don't mind, just briefly.
So I'm Rachel McCloy. I'm Associate Professor in Applied Behavioural Science at the University of Reading. Just to follow up what Lindsey says, is I think sometimes we don't, as academics, we're not as aware of the different steps in policy and exactly where we can feed in. And there are plenty of opportunities available via things like consultations and so on, where the evidence you put in place and you put in play is publicly available. So what you have made available to government is there for anyone to go back on. So you can put forward the evidence that comes from your knowledge and your expertise in a way that feeds in, but that it's not as filtered as that as well, in addition to also building those relationships with civil service and with the, in our case, often the government social researchers who are working to try and integrate all of this evidence and put that forward into impact assessments and into policy. So there are a range of ways that you can put yourself publicly out there
Okay, that sounds very positive. Does anybody else want to comment on that on the panel? In that case, could I ask, I don't know, I don't want to put anybody on the spot, but I do have a question for René. Well, just can you give us the European context on the question that we just put on the table? I mean, this, you know, and this interaction between policy and science, and how the evidence then can retain its independence, and what safeguards are in place there. Do you have any views on that?
Yeah, so I'm smiling because, I mean, on the one hand, I'm on the side of the researcher, but on the other hand, I am part of the European Commission. So I work in the kitchen. I mean, and I am aware that there's an art to bringing science to policy making, and that if we hold this kind of idealized view that it's about transferring knowledge through the appropriate channels and through the appropriate format to the right people, then everything will be fine. So this is the front office kind of explanation, and that's the one that we adhere to as policymakers, and we adhere to as researchers as well, because we, the whole evidence-based policymaking narrative is very useful for science. But of course, we cannot be naive, right? So we know that that more goes on, and you have the cases of cherry picking, or finding out, asking contractors to produce evidence, and maybe there's no fishy business going on, but if you're paying somebody to do the work and they know that what you're expecting to find, there's a bit of pressure to give you something that you can use. So knowledge is ammunition in the in politics, and that's another way of looking at it. These proposals are put on the table, and everybody in this evidence-based policymaking environment needs to provide the evidence to argue the point. Now, ideally, of course, first you looked at all the evidence and then you came up with a point. And you don't want, but oftentimes the point, it has been pretty much not decided, but there's an idea of where you want to go, and let's just make sure we back that up with evidence to make sure it's fine. Then you have very extreme cases like what you mentioned. I think you were alluding to, I think, the issue of behavioral fatigue, right? It was is in the press a lot, maybe larger, but that phrase has stuck as, where did that come from? And I think at the time we all looked at it as, well, it just looked like a very blatant attempt to give this thing a label. And we saw the Prime Minister flanked on right side and left side with science advisors, and that that's being done because that gives it legitimacy. So it was all a little bit too blatant an attempt to legitimize a position with science. And I think the scientific community had a very quick and emphatic response to that. So we know that that's an extreme, that doesn't work. But then we know that the other extreme is also not true, in the sense that just science is transferred and everything is built up on existing knowledge. So I think we navigate somewhere in the middle. And I myself don't have a clear answer on what to do, what's the right way. I am aware of the pitfalls, but I am convinced, of course, in the value of evidence and evidence-based policymaking. So I don't have any answers, but I share the concerns and the challenges. So,
yeah, if I may make a comment on that, René, I think actually the event you're referring to and the follow-up are really, really interesting, because I think one consequence of the scientific community's response to that initial proclamation of behavioral fatigue that at the time none of us really understood. One consequence, I think, ultimately has been the creation of independent SAGE. And for those of you who are outside the UK, this is a an independent expert body that constituted itself just because they felt like it, to parallel the real SAGE, which was created by the government to advise the government on science. So it was a very interesting development of sort of an autonomous grassroots creation of a parallel expert body that had its meetings in public online. Completely in contrast to the government SAGE, where initially the identity of the people on it, I think, were even hidden, and there were no minutes and there was no transparency whatsoever. And what's now happened in consequence, I think, is that there is more transparency, and it actually had a remarkable effect, I would argue. I mean, that's just my view on this, but it raises a deeper issue, which is that of the line between science and activism. We're talking about science and policy. I think there's a flip side here, and the COVID situation in the UK has actually identified that. And that is that scientists sometimes are not just doing policy, but they're also kind of being activists. And so, does anybody want to comment on that slightly risque minefield that we all either observe or live in? Mirjam is disappearing. No, she's still here. Okay. Anybody want to comment on that? Again, I don't want to put anybody on the spot because this is very interesting and exciting, but also pretty hot. Yeah, Lindsey.
Yeah, no, I think it really needs that clarity of thought when you start out in this, and clarity around questions like what's the difference between research, policy engagement and lobbying? Where is your line there? Do you really think that you can be an objective, impartial expert, clearly reviewing the whole breadth of the evidence, or will you be providing your own view, which may be skewed one way or another? How can you make sure you are impartial? From my experience, policymakers want researchers who can provide their literature review, so their sort of broad brush knowledge of the whole literature of what they do, rather than purely telling people about their own projects and their own findings. It's the expertise that's valuable, but how impartial can you be, and what declarations, I suppose, are needed around where your own biases might lie.
Okay, thanks, Lindsey. Now, without connecting to the previous question directly, and again, not wanting to put anyone on the spot, I would still love to hear from Paulina if you had any views on this whole space. And of course, once you introduce yourself, people will know maybe why I'm asking you.
Of course, my name is Paulina Lang, and I'm a behavioral scientist working in the Cabinet Office. So I am a civil servant, but I am also a former academic. And I would say our team works as a conduit in many ways. For example, as a conduit between policymakers and communicators, also as a conduit between a subcommittee of SAGE, which is SciBeh, who advise on behavioral issues, and policymakers. At least we try. So I think a lot of things that have been raised here are, issues that we come across every single day. Cabinet Office benefits from having a team who are quite academic, so we can try to ensure that whatever advice is sought from academics is not biased, or that actually, let me rephrase it, that we ask the right questions, because I think that's often where issues start, which is at the point of defining the question that is then posed to academics, that is posed to communicators. the questions that define everything that follows. So what our team tries to do is work with policymakers to make sure that they refrain from making assumptions about people's behaviors and that they think in behavioral ways. So whatever the policy is, we try to break it down into very specific problems, very specific behaviors. And I think that in a way helps with making sure that we look for right evidence and that we don't ask leading questions. So I think that's just one example of how our team tries to make sure that whatever evidence we seek is going to be considered in as objective way as possible. So I always go back to the question that's actually asked and making sure that it is as behavioral as possible.
If I can follow up.
Please do.
Yes, no, that's very good. And if you break it down exactly, if you find what we say the behavioral element, whose behavior is relevant to this policy? What are we talking about here, and how can we intervene? And when you break it down to that level, then to a certain degree you move away from the politics and you move away from your opinion, because you're really just saying it's just an analysis, a diagnostic of what's happening, whose behavior is relevant, and what can you do about it. Now, whether whatever policy remedy you end up suggesting or testing, whether that feeds into, okay, a neoliberal agenda because that's rolling back the state, and that can be then interpreted in many ways. But really, since you've broken it down to specific issues, specific individual behavior, you're in a way a little bit further away from the politics of it. So I think I see where Paulina is coming from.
Okay, does anybody else want to comment on that? Yeah, Rachel, please.
I'll remember to unmute myself again. I think there's an interesting question between what Paulina's just said and Alison's earlier talk about the framing of questions and making sure that the questions asked are asked at the right level. And I wondered, actually, it's almost a question for Alison more than anything. With that in mind, how do we bridge getting the questions that are coming to the kind of recommendation algorithm that you're going to have, getting those questions at absolutely the right level to make sure they include enough evidence and don't exclude other evidence, particularly when it comes to things like unintended consequences and so on, where you might have a wider range of social impacts and so on of a policy. Do you have any ideas there?
I think you've just touched on one of our areas of challenge over the next year, is actually to try and figure this out. So I think we have a sense of what variables we need to get people to specify to make sure the questions are such that the prediction they get back isn't just, well, could be not, it depends. It's not a prediction that any policymaker is going to find useful. So we know a bit about what should be specified in terms of the dimensions of behaviour change interventions that affect effectiveness of interventions. I think, and this picks up a question that Lindsey asked me earlier, which unfortunately I'd missed in the chat at the time, Lindsey, so sorry about that, which is about what about other aspects of the outcomes of intervention beyond just do they change behaviour, or do they have their intended outcomes, the things like equality and unintended consequences. I don't think our system can deal with those yet. It's presumably going forward in the future, that's something you could get a system to maybe synthesize, but the actual bringing it together, I think for a long time that is going to involve humans, and therefore is going to possibly be subject to some of the biases that humans always have. And the other thing to say about an AI system is not just that the biases of the developers get coded into the algorithms, but the biases of the training data being used on the system. So actually, in that we can't go back and undo the biases in decades of research on behavioural science, which unfortunately probably have privileged certain groups over other ones. Actually, I think knowing the system is going to be imperfect and articulating the ways in which it's not perfect and making those clear is probably the best we can do at the moment. I think it's a really good point there going forward to think about.
Okay, great. Now I want to segue just a little bit, if I may, because one of our panel members is a sort of practitioner on the front lines. I'm talking about Mirjam, who is, well, tell us a little about what you're doing, and then I'll follow up with my question, maybe.
Okay. So I'm a scientific or a cognitive scientist by training, but I've switched to the Robert Koch Institute, who by now probably most people know. It's Germany's public health institute, and in July they created a new unit for science communication and risk communication, and I'm the head of that unit, and work together very closely with scientists, the health ministry, and other players to inform experts, so for example doctors or nurses, but also the wider public on currently anything related COVID, but then in the long term also just on public health and kind of medical topics in general.
Yeah, okay. And so I guess what I'm interested in, or what I'd like to know more about, is in your sort of day-to-day experience, how does this interface with the policy community or the public work? And also, if you don't mind, if it has happened, can you point to the issue of uncertainty or ambiguity, ambivalence, conflicting scientific opinions, and how you deal with that whole kitchen sink full of problems? And of course, I'm raising this now because I'm hoping the others can chime in as well, but maybe Mirjam, you got some sort of day-to-day frontline experience.
Yeah. So we work together very closely with politicians at this point, or mainly also with the communication people from political organizations. And the goal behind this is just to have a unified language and unified messaging when it comes to what people should do, how they should behave in helping to mitigate the pandemic. So as long as results are not skewed or messages are not politicized, I'm okay with that. And so far it's been going well. One of the challenges in Germany, actually, I think, is that, especially when it comes to behavioral research or behavioral topics, it's often not the behavioral scientists that are asked, but the medical people or virologists or epidemiologists who actually don't really know anything about it. So that's a challenge. So I think just getting kind of behavioral scientists out there and more visible, as with the creation of this new unit, is very useful. And when it comes to uncertainty, I think Germany has done pretty poorly in the past, especially the communication of wearing masks and kind of uncertainty in the evidence when it comes to their effectiveness, that was especially prevalent in the beginning, was communicated very poorly. And I think that actually shook people up, and many people are now aware, and also non-scientists are aware of how important it is to communicate uncertainty. And so we are actually, when it comes to communicating the effectiveness of future vaccinations against COVID, that's one of the main topics of the task force, is how to communicate uncertainty on different levels. So uncertainty when it comes to the study quality, maybe what kind of studies can we look at, and can we cite when we communicate about the effectiveness, but then also when it comes to so for example, different subgroups about which we may not know as much, and so there's also uncertainty in that. So I mean, yeah, as you will all know, there are different levels of uncertainty, and we're just trying to explain those levels, and by that also trying to explain some of the processes of science, and that uncertainty is normal and needs to be taken into account, but doesn't mean that the science is fraudulent or bad or weak.
Okay, thanks, Mirjam. Great. So I now want to, okay, we've got about 15 minutes left. So I want to now basically, first of all, open it up to the all of you on the panel to connect to that question about uncertainty and how to communicate that to the public. And then we have a bunch of questions that came in in the chat, and I will read those out once we've dealt with the uncertainty issue. So over to you, any of you, just raise your hand or unmute and comment on that as you see fit. And while you're thinking whether you want to comment on that, let me just give you some data that I thought were fascinating. They're from Germany. Earlier this year, they did a number of surveys on the public's attitude towards science, in particular relating to COVID-19. And one of the really fascinating results, other than a dramatic increase in trust in scientists, one of the most interesting results was that the majority of the public actually thought that the scientists battling it out with different opinions was a good thing because it would ultimately reveal the right answer. And I thought it was a fascinating, yeah, I mean, it was, I couldn't believe it, but it was something like 80% of the public sort of agreed with that or strongly agreed with that idea that actually having different opinions is good because then you battle it out. Now, there's other data that suggests that, you know, false dissent that's undermining a scientific consensus is very damaging. But in this particular case, there was a very positive result, I thought, and I can drop the link in the chat later. Now, if that hasn't stimulated anybody into responding to that, then let me go to a question posed by Ulrike. And her question is, I wonder whether the very kinds of things that will make the policy science interface more effective, so building trust through working relationships, will be the things that undermine the relationship between science and public. And both are vital. So is there an issue? And if so, how do we resolve it? That's the question. Who wants to comment on that, if anyone?
I'll give it a go.
Yeah, please.
I mean, I think there's a different issue when it comes to scientists talking directly to politicians and whether we get lumped or tarred with the same brush specifically as politicians and being thought that our work is political, and when we talk to the civil service. And I think there's a very, very different link, so that you're seen as working in the public interest when you work with civil servants, much more so than you are if you're seen there directly with politicians. So thinking more about that relationship and where you can strengthen that relationship, because I don't think it has the same degree of negative connotations that you're feeding in, if you're feeding in and talking to civil servants rather than being seen and tagged with those who we know traditionally do very poorly on trust ratings, whereas we scientists tend to do a little bit better. But I don't know, I mean, Paulina, I assume you probably have a view on that as well.
You could probably see me nodding because I'm really actually glad that you mentioned it and you made that distinction, because I think it's very common actually to conflate the two and think that policymakers are in fact politicians. And very often the people who are policymakers or considered policymakers are people who advise on policies, and those will be people who will often come from an academic background. There will be social researchers. They will start to specialize in certain policies, but they will very much at least aim to be objective. This is how civil servants work. We don't work for a political party. This is something that I observe on an everyday basis. People do make an effort to be objective. So I think making a distinction between working directly with politicians who have a political agenda, that's their job, and working with policymakers and civil servants is a very important one to make, and also for civil servants to keep reminding everyone about the difference as well. So really just to reinforce Rachel's point that I think it's important to make those definitions clear.
Lindsey, go for it.
Thank you. Yeah, I would completely agree with that as well, and also flag up that policy making isn't purely done on a national level. So there will be local and regional, policy makers as well. There's a really big drive in the UK right now for universities to become more civic. So, being properly part of the place where they're based and being positive contributors to the town or the city or region by sharing their knowledge, by doing knowledge exchange, and also by brokering conversations in between wider publics and policymakers and researchers, so that we gain from all of those perspectives. So I think, yeah, it's sort of all draws back down to who is the decision maker, because it may be done around a much more sort of local or regional level, rather than big fancy national decisions.
Anybody else want to comment? Okay, if not, then one of the things Ulrika raised again, and I think you've already, well, you mentioned it, there's a difference between policymakers and politicians. And there's also a difference between policymakers and scientists. But the question, I guess, that concerns me is that we live in an age where, 70 million American voters think that there is a president up against the deep state, which is everything they don't like, including scientists. There have been calls to behead leading American epidemiologists, and with the scientists, policymakers, politicians, it's all one big thing. Now in the UK or in Europe generally, I know it's not that bad, but how much sophistication can we actually expect from the public about this distinction? Policymakers, politicians, scientists, isn't it all the elite now that is thwarting the will of the people? I know that's getting us a little away from the science policy interface, but I personally think it's absolutely crucial to navigate that space, because that's what we're up against. So if you have any great ideas, now is the time.
So I don't have any great ideas, but to a large extent, it's true, but it's I think a lot of it is explained in terms of just sort of in-group and out-group dynamics, and being in a place where the elite is just looking down their noses at people like me, and then that generates simply an emotive response, and we can stop right there. That explains a lot of things. And then to another degree, yes, you can then say, well, is the onus then on the, I'll use the term, the liberal elite to then, explain the issues, make the science transparent in order to gain credibility and gain trust, or is it a wasted effort because actually the explanation is much simpler than that? And so that could be the case. That's an interesting question.
Yeah, I think that's a great way of focusing the question for us. I mean, to what extent, how far do we go to try and make ourselves transparent? And is there a point where we just have to stop trying to be more and more transparent or whatever, because we're up against people who are just not interested in anything we have to say? Yeah. I mean, and Lindsey, I think, had her hand up.
Oh. I think on a slightly more optimistic note, it's about flagging up the role of public engagement as well. There's plenty of expertise about how you can engage with various publics, and it's probably linked as well with the issue of diversity in science. So if you can show researchers that look like you and that come from the same background as you, it's harder for people to make the argument that we're all part of some elite. So it would really do us some favors, you know, to be more diverse and more inclusive in the research community, as well.
If I may, I don't know how to raise my hand, Richard.
Yeah.
So just linking, that's a great point. And also linking back to what Alison was saying in the human behavior change project, if we could, you know, through these algorithms and these tools, you can make it very simple and very transparent. You ask a policy question and then you get, you know, a filtered, you know, response. And if this is open to everybody, maybe not to, maybe somebody in the, just somebody at home wouldn't be interested, but the press would be. And if a journalist can go in and say, okay, well, listen, the government is doing this, let me ask the question, what kind of results do I get? If those results are then in line with what's actually happening, then that gives some sort of legitimacy to the approach and makes it transparent. So that could help in that direction.
Okay, great. Now we're down to about 4 minutes or something. So there's one question from the audience, and I'll give it 2 minutes for an answer. The question is whether participative methods like citizen science, knowledge co-production, and all that, to what extent they might solve the problem that we've just identified about trust and populism and all that. Does anybody want to give a quick answer to that? Yeah, Mirjam. Oh, no? Yes? Okay.
I don't have the evidence to back this actually, or not much, but we will actually try exactly this together with the health ministry when it comes to communicating what it means to contract COVID and to get ill, by actually portraying people who've had it and let them speak and let them address the audience, and then of course put that into context and add scientific facts to it and maybe explain a couple of concepts, about kind of use this combination of narratives and scientific facts to hopefully make people relate more and relate to the facts through the people, the personal stories. And that's risky. It hasn't been done before, but there's great interest actually. And yeah, I'm curious as to how it will turn out and how it will be received by the public.
Okay, thanks, Mirjam. Perfect timing. We now have 2 minutes left, and what I want to do during the 2 minutes is just some very brief housekeeping. First of all, the link that allowed you to attend here will be the same tomorrow for the workshop sessions. So I hope to see some of you or all of you or even more of you back tomorrow. And this afternoon, UK time, the hackathons will all have their own links. So if you're listening to this now and you want to attend a hackathon later this afternoon, you will have to come back to a different link. And I think that stimulated Dawn into popping up, and she may want to take over from here and say something else that I missed.
Yeah, so I was just going to pop the links into the chats for anyone who's here, but otherwise I've sort of been communicating with people who've expressed interest. So I'll just say again, if you haven't got a link, email me. I'm the one who's been sending you all the emails about where to go. So yes, get in touch with me and I'll get you those links.
Okay, great. And on that note, I want to thank all our panelists and speakers. I thought it was very stimulating, very interesting. And yeah, so thanks for doing that. And I hope I'll see some of you tomorrow in the session. And with that, we draw it to a close for now. Ciao.